Welcome to ViewPoint.
Where we give you our point of view.
All day long.
I'm Kip Wise.
I'm Allison Coleman.
I'm Chichi Okeke.
Today we will be discussing the new meaningful use EHR requirements for healthcare organizations.
We all have heard about new regulations on PPACA, which is going to be starting in January 1st, 2014.
We've all heard about the larger facilities rolling out their EHR programs, but what I'm interested in is the smaller facilities and how they'll roll out their programs. In my opinion, they have more significance in the community.
Well, Allison, I'm glad you brought that up, because I've been doing a little bit of digging and I found this project charter from a small nursing facility in rural Georgia who appear to be rolling out their own EHR system.
Let's take a look at this.
Now, right here, first sentence, it shows that this facility is committed to positioning themselves as Georgia's first choice in skilled nursing facilities. Now, how is this EHR program going to help accomplish that?
Well, they have three major objectives. The first one being improving reimbursement. The second one, improve quality of care. And lastly, increase operational efficiencies. Now, at PointClickCare, they know that not all facilities are alike. They know that there's small versus large, and generally the smaller facilities operate with fewer resources and need unique solutions that are cost effective that will help them drive business. The larger ones.
Now, PointClickCare, that's the software they're implementing at this facility.
That's the software, yes,
Okay.
PointClickCare.
I'm seeing here where it's a web-based software. How are web-based solutions different than in-house storage facilities or storage solutions? PointClickCare supports clinical, financial, and administrative documentation. Now that's very different from these larger facilities whose software can only support clinical or financial, where they have two different softwares to do each. How is the integration of all three of these fields going to affect this facility and their operations?
It's going to streamline and connect clinical billing, administration processes to maximize reimbursement, enhance quality of care, improve operational efficiencies, and increase staff productivity and satisfaction, and also reduce risk to the business.
I'd like to go back and talk about integration, because I think that would be a key component in this EHR rollout. It's important to have all facilities integrated so that they're working in the same system for easier access to patient records.
Well, how are we going to go about getting every organization working on the same system? Because whereas this facility may be on PointClickCare, another facility may be using a whole different software line. How are we going to ensure that each different system can communicate?
Well, I think that's the question here. I believe the PointClickCare is working to do that within these facilities.
Now, something interesting that PointClickCare is doing is they are implementing the new eInteract certification with their platform. Now, the Interact, that's the tool that these facilities are using to determine if a hospital readmission candidate is appropriate for hospital readmission. Say a patient has an adverse event, they'll use this tool to determine if they need to be sent to the hospital or not. Now, this is something different than what we've been doing for decades and decades in these facilities, where we just send them right on out anytime something goes on. How do you believe this new Interact feature is going to help these organizations and the other new implementations that these softwares are coming up with?
The project success factors are going to help take care of that. They have three of them. They're going to maximize revenues, optimize care delivery, and centralize process and compliance. Now, it looks like they have a pretty hefty budget for this new EHR program. Total, it's going to be $235,000. That seems like a lot of money.
Not really. When you put it in perspective to all these other facilities who are paying millions of dollars for their initial implementation of their EHR programs, the small facility is actually getting a fairly good deal. Their hardware is only $100,000, the software itself is only $30,000. And then after this initial cost of nearly $250,000, they'll only have to pay $5,000 a month just to keep the system up and running.
You make a good point.
I think it's a great idea. This is one-time fee.
Exactly. This is just one time, and they've known about this requirement for a while. They've probably been saving up and pinching pennies to make sure that they could get this rolling by the deadline. And speaking about deadlines, it looks like the implementation process isn't going to last very long. According to this, it'll start at the beginning of May, and they'll be fully up and running by October.
Wow, such a short turnaround.
Y'all think that is too quick to be able to get all this stuff up and running properly?
Well, I think it could be done, but who are the key people to start the project of the organization?
Well, typically it'll always be your administrator and your DON in one of these nursing facilities. But they've also selected their medical records personnel for data entry and their quality control nurse and their staff development coordinator. Now these are positions that would obviously be involved in a new implementation of a new system like this. The staff development will get everybody trained, quality will measure the results of this new system, and then of course you've got to have the administration involved to make sure that everyone's on the same page.
Now, what is the training strategy in implementing this new program? I read somewhere where it said something about a sandbox strategy. What is that?
See, I'm not too familiar with sandbox style training myself. I've never gone through it, but from what I understand, that's where this Westcom team will come in and provide training to all the upper level management and the high level department heads. And from there, they'll be able to train their own staff to do each individual function. And that way, this style of training is unique because then it's in-house training after the initial training. The department heads will be able to train their staff and be able to continue to train new staff as they come around.
So it's from top to bottom.
Exactly.
Seemingly more effective strategy.
And that way they won't have to, whereas direct training where this computer team will come in and train everybody, they're not going to be able to come in every single time a new person's hired.
It's true. Very true.
With this in-house training approach, they will be able to train in-house and train as new employees are hired so that everyone is on the same page and everyone receives essentially the same training.
That's very important.
But all in all, this project charter seems very detailed, and I'm hoping that with this much work, they can pull this off.
Well, they should be able to with the $235,000 budget.
And their 5-month time frame.
I think this will be a big benefit to the facility.
I think it will be very interesting to see how the smaller facilities do end up getting their EHR systems up and running to meet these regulations. And this is something we will definitely be looking at in the future.
We'll keep our eye on it,
That's right.
That's all the time we have today. Thank you for joining us on ViewPoint.
where we give you our point of view.
All day long.